I'm doing very well, and you?
I'm very well, thank you. And of course, you've come this afternoon to tell us a bit more about National Lupus Awareness Day. But I think first and foremost, it is so important that we take a look at what exactly lupus is for those who may not know.
Okay, let's put it in layman's terms so everybody can understand. Lupus is an autoimmune disease where your immune system that's supposed to protect you turns around and fights your own body. So you get two different kinds of lupus, systemic lupus erythematosus, and then you get the squamous lupus. The systemic SLE, as we call it, is inside, and that affects your organs. The discoid lupus is outside on your skin. And you can have both. You can have one. It depends on patient to patient. Every patient is very different because it's a terrible, terrible disease. You do not know what's going to happen to you tomorrow because any organ, it can attack any organ, your heart, kidneys, brain, lungs, pancreas, liver, anything. It can attack anything and can cause death at any moment in time.
Wow.
So it's a very, very serious disease, and I think South Africa has taken it too lightly for too long.
Absolutely. And so a question comes to mind. In terms of stats, how many people to date within our country have lupus?
Okay, we had to use outside companies of outside South Africa in order to get the stats for South Africa because South Africa didn't even know what lupus is. Wow. But we got the stats with our new census. According to our race, gender, and age, there is plus minus 280,000 people in South Africa suffering from lupus.
Wow. And so what are the common symptoms of lupus?
Yeah, it's very dependent on patient to patient. But the basic things are, hair loss. The first thing that is the worst is fatigue. They get a lot of fatigue. Then they get they can get skin ulcers and stuff like that. Then you some hair, you get mouth ulcers. You struggle breathing, which is your pleurisy. You feel like anxious, which is pericarditis, which is inflammation around your heart. You get blood disorders, which is a higher blood cell count or a low blood cell count. You get high white blood cell count, low white blood cell count. You get your other disorders like your eye disorders, which is Sjögren's syndrome, which is dry eye and mouth. There's so much. And then the main thing is arthritis, rheumatoid arthritis, and huge amounts of pain in your body, your joints and your muscles because your muscles spasm.
Wow. It sounds like a really, really scary disease to have. Now, Susan, a question comes to mind. Who are the at-risk groups for those developing lupus?
Okay, usually, we've seen, there's stats on that. And we've seen the stats, but in the last few years, let's say in the last 3 years, there's a lot of stats that, there's a lot of people that are out of the stats. It's usually women between their childbearing years of 25 to 45 that is at risk. Our colored and our Africans are more at risk. But we've seen also, we've got a huge amount of patients that is young. We had a 7-year-old girl. We've had a 3-year-old baby that has died of lupus. So, and then you get 18-year-olds, 19-year-olds. We get men as well. We get elderly people as well, getting lupus in their old age. So, the stats say it's women in their childbearing years, but they are definitely the other ones out.
Now, a question comes to mind. Of course, you're going to be having all these symptoms in the beginning. And, of course, you might think that it could just be maybe the flu or whatever. But how long do these symptoms actually last before the really scary ones set in that would indicate that this is lupus?
You see, that's the scary thing because it's very difficult to diagnose lupus because sometimes other conditions are involved as well.
Right.
And then also a physician is not always the first thing to test for lupus. They test all other kinds of things, and then they diagnose chronic fatigue syndrome, which is the yuppie flu, and then in the end of the day they find out it's lupus. So it's very difficult, and it could take years.
Wow.
But American Lupus Foundation has given out 11 criteria to diagnose lupus.
All right.
And that is what I always think to my patients if they have, a fear that they might have lupus. And then you check according to that 11 criteria. And if you mark more than 4 of them, you definitely need to get to a physician. And I think in South Africa, it's now at a stage where we should look after ourselves and then, go to the doctor if we suspect something. We do not need to, wait until the doctor kind of diagnose you, because there's a lot of things with lupus. It can be, check yourself.
Absolutely. Now, Susan, what treatment is available for those diagnosed with lupus?
In South Africa at the moment, we have, they use malaria medication, they use chemo medications, they use cortisone, which is very important for lupus patients. They use Salfit, which is the anti-rejection drug. They use various but none of the drugs was actually made for lupus.
Right.
Now, we are lobbying for a medication that is registered in the United States and to be registered in South Africa. That is the first medication in 52 years that was developed for lupus.
That is really scary. And as a lupus sufferer, should they be following a specific diet or nutrition plan?
You know what? The thing is, it depends on your lupus patient yourself. I am myself am a lupus patient.
Wow.
So you watch what you eat. You make sure that you do not you eat food with MSG. Physical drinks. All that stuff. All the things. Just a healthy diet. And it also corresponded with the doctor looking after a lupus patient called a rheumatologist.
All right.
Now, talk to your rheumatologist with what to eat and not to eat, because sometimes something healthy might be something that you're not allowed to with your medication. So there, your healthcare professional also steps in and help you with that.
All right. And what are the common triggers for a lupus flare?
The
common triggers. Is there a particular trigger that people, you mentioned that there was this 11 steps that you send to your patients. So what are those 11 steps? Or say, for instance, it's a combination of those 4. Could you give us possibly a combination of those 4?
Oh, okay. You mean the criteria for
yes.
Diagnosing lupus? That is positive ANS test. That's an anti-nuclear factor blood test.
Okay.
That's the losing of the hair, the mouth ulcers, the struggling breathing, heart palpitations, all those symptoms that I've named.
Okay.
That if you have 4 of them, yes.
All right. Now, you mentioned the loss of hair. Does that occur almost immediately, or is it sort of over a period of time?
You see, because every lupus patient is different.
Okay.
It could come while you're in a lupus flare, or it can start from the beginning when you start, showing symptoms of lupus.
Now, Susan, from everything that you've mentioned, it seems that lupus is a very dangerous and serious disease to have, because first and foremost, it's not always diagnosed correctly, and secondly, like you said, it could take a couple of years before it's diagnosed correctly, but also it's not a disease that South Africans are taking very seriously at present.
Yes.
So it is something very scary, and just listening to what you're saying, and you being a lupus sufferer yourself, based on your own experience and what you experience on a daily basis, what is it like? If you could tell us, what is it like to be a lupus sufferer from your personal experience?
I think the most, in the beginning when you get diagnosed, it's a shock.
All right.
And then knowing what you've got, you first have to go and research, because they don't properly tell you what it is,
All right.
then you are huge. It's a huge shock. Then also you need to make, peace with the fact that you're not going to be able to do everything that you've ever did before.
All right.
You're never going to be the same person that you were, because most of our lupus patients, I still work, but there's most of our lupus patients, 90% of them, that can't work.
Wow.
They stay at home. They have kids. Sometimes they can't take care of their kids. Sometimes they have so much arthritis in their hand they cannot pick up their baby. So you need, first of all, you need infrastructure. And I think, I just praise God for the family that I have. But that is the greatest, of the things. You need to have an infrastructure. You need to have the finances to be able to, get your medicine, because some of our patients had to stop working because they do have lupus. But then they don't have an income, so they don't have medical aid. Now they have to rely on state hospitals, and getting medication from there is very difficult. And that is where Hillside Ministry comes in, and we try to help patients to pay for their medicine. And then also, the fact that when you're ill, and you tell somebody, I've got lupus, they don't know what it is.
Yeah.
It's actually so bad, because, you're fighting for your life on this side, and that person talking to you don't have an idea what you're going through.
Wow.
The people in the community don't care about lupus because they don't know what lupus is. So you have your very few people, and as I also explained to my patients, also we counsel a family as well, and we've got a family program where we tell the caretakers what to do, because as a caretaker you also need to do certain things for a lupus patient, because sometimes they're bedridden, tomorrow they're fine. That's the way lupus goes. And then also you tell their families, it's the most important thing is teach their family and their community about lupus.
Wow. Now, a question comes to mind, and I think this is a very hard question to pose. Is lupus curable?
No, it is not. As we explained yesterday, and I am in contact with America on a monthly basis, there has not been a cure developed for lupus as of yet.
Wow. And once a lupus patient is diagnosed, how much time does a doctor normally give that particular patient?
It depends on the severity. You get mild lupus, which is your patient that, sometimes they go on the anti-malaria drug and they have the full life, and, they have healthy. They're very, very healthy. And you get severe lupus, which is the lupus that like, for instance, they gave me 5 years.
Wow.
And that was in 2005.
Wow.
So, you get your severe cases. And then also, it's very difficult for doctors to actually put in a lifetime or a lifespan there. It's basically on statistics that they talk about.
Yeah.
But the thing is, because you don't know, that patient's heart can give in tomorrow. If a lupus has attacked the heart, if a lupus has attacked the kidneys or the lungs, they might need a transplant, or they might not live tomorrow because they'll die because of what lupus has done to the lungs. You never know, as a doctor, what's going to happen to your patient next.
As we end off this afternoon, Susan, is there a website that the public could use for further information, please?
Yes. It's www.eaglesflight.ministry with a y.co.za.
As we end off this afternoon, what words of encouragement or words of awareness do you have for the city of Cape Town regarding lupus?
Okay, I just wanted to say that the Western Cape and Gauteng is our highest area of lupus patients. Regarding, a word of, advice to the patients is we have a saying amongst ourselves, we fight for our lives, but we will never give up.
Wow.
We will wait and we will fight because we're lupus warriors, and we will fight until there's a cure, and we won't stop. And to the public and the community out there, I just want to say that, get involved with lupus. It's a bad disease, and the lupus patients in South Africa need our country. We need our country's support.
Thank you very much, Susan, for joining us telephonically and telling us a bit more about National Lupus Awareness Day, as well as your own journey with this very terrifying disease. And my prayers are with you and with all those currently suffering with lupus. Thank you so much for your time.
Thank you so much for helping and showing an interest, eh?
You have a good afternoon further. We'll chat soon.
Okay, then.
All right. God bless. Bye-bye.
You too. Bye.
That was Susan van der Walt, who is the chairperson, if I can just get her title.